32 million Americans are using laundromats. They're spending 2 hours on site waiting week after week. And so that time and that depth and recurrence of time to myself and to our team at Fabric is just fascinating and really overlooked and underutilized. It's got to be muffins before mammograms. And I think fundamental to that is you have to build a relationship and you have to have trust, particularly when there's so many scams, when there's so many things that just don't work for working class families and are incredibly difficult.
I have an aunt who is what you would call a dual eligible. She's both on Medicaid and Medicare and living in Missouri. She's also blind. She's completely blind. And she lives alone. And she was sent a physical paper letter in the mail asking her to confirm that she was still blind in order to continue to receive her benefits. And of course, because it's not accessible, she does not fill out the paper form because she cannot see it and then loses her benefits.
I think healthcare has all of these trapdoors and we wonder why things aren't working.
Hi there, I'm Christina Far and this is Second Opinion, the podcast that cuts through the noise in digital health to deliver what you actually need to know. We're tackling the topics that matter with brutal honesty and depth through conversations you won't find elsewhere. No talking points, no hype, just clear insights to help you navigate what's really happening at the intersection of health, technology, and biology. Let's dive in. Welcome, everybody, to the Second Opinion podcast. I am so excited about our guest today, Courtney Bragg. There's just so much going on in the world of tech and policy, entrepreneurship, innovation. And Courtney is the CEO, co-founder of a company called Fabric Health. She's really seen it all because her experience spans for-profit and non-profit. She's been involved in DC. She's also been backed by VCs. So I'm excited to chat with her about just so many things going on in the world today, as well as her company. And just on a personal note, she and I first met at a dinner that was hosted by one of her investors, TMV, and she was invited to speak alongside a room full of other entrepreneurs. And I just remember thinking to myself, like, what she is building is really different and really unique and special. And I'll let her tell you a little bit about it. She's very good at telling the story, but I'm excited for you guys to hear more about Fabric. So with that, I'm going to say hello to Courtney. Welcome to the pod, and let's have a chat.
Hey, Chrissy. Thanks for having me. I'm excited to catch up.
Okay, so let's cast our mind back to that time that we met and we were going around the table and everybody was giving the elevator pitch. Can you recreate it for all the listeners on the pod?
I will do my best. I like to start with, my name is Courtney and I'm obsessed with laundromats. I think for people, they think that that's kitschy or niche, but for us at Fabric, it is just baked into our DNA, right? 32 million Americans are using laundromats. They're spending 2 hours on site waiting week after week, and 70% of laundromat users are women. And so that time and that depth and recurrence of time to myself and to our team at Fabric is just fascinating and really overlooked and underutilized. And so for us, it's about meeting people where they are literally, and then building this incredibly sticky, trusted relationship. And we found that spans the kind of healthcare continuum.
Okay, so you guys, I bet, didn't expect that when I said Fabric, that it literally meant fabric because we were talking about laundromats.
It's a little on the nose.
It's very on the nose. And there are other companies called Fabric, but this one is really about fabric. So let's get into this experience of the laundromat that you mentioned. You say it's captive, which I think is pretty unique and special about laundromats because people just have to stand there for like 40 minutes longer while they do their laundry. So what does your team do while they're just standing there, sitting around, waiting at the laundromat?
Yeah, absolutely. So 2 hours of dwell time with the hardest to reach, generally disproportionately women and generally moms who are making the care decisions for a generation below and a generation above. It's really, really interesting to my co-founder, Alistair, and me. And for the first 6 months, it was the two of us in laundromats in North Philadelphia and figuring out all of the things you don't say and you don't do, right? So walking up to someone and saying, do you have insurance? Not the best icebreaker, like a little tone deaf. So we have spent something like 837 days of time with the families that we serve to date. And for that, that's been all of the things that I think is exactly how we think you need to build in healthcare, which is with the user at the center, and then building tech and things that support. And so I'll give you some early examples and then I'll talk about what it looks like now. So, right, initially it was a little bit tone deaf of like, do you have health insurance? I am, in my background and in my DNA, an educator. And so I quickly realized that that made no sense. And I made these neon pink QR codes and I put them up around the laundromat. And then I made these little neon yellow and pink 4x4s. And I started changing the framing and saying, first offering mom a laundry cart and having a conversation in Philadelphia, always about the Eagles, go Birds, and building this just organic relationship, which we think in healthcare and venture in particular, that like that isn't possible, that that's really hard. That takes so much time that it doesn't work. And we find that we can build an incredibly resonant relationship in 30, 60 seconds. And it's about building that relationship. It's about having that very quick conversation. It's about offering mom a laundry cart. And then within that time, you can be doing a health risk assessment. You can be doing an SDOH screener. Like you can be doing all those things as long as you're human first. And I think that's really what it boils down to. So there's a ton of technology, but we think about this kind of framing of its services enabled tech. And so we have integrations with the laundromat point of sale systems. So I know when a laundromat is spinning and I can send you a text right when you walk in or leave the laundromat and those kinds of things. But for the person who is at the center of everything we do, and for this mom, it is about a trusted relationship being built in that time. And it starts again with that very human aspect of offering her a laundry cart, asking if she's engaged with someone from the Fabric Health team. And then what we find is in building that relationship, she will text us back, she will call us, she will tell her friends and family that Fabric can help get you insured, that Fabric can help make you a pediatric appointment, all of those things that I think we forget how difficult they are every time you try to touch the healthcare system.
Just from the moment the company started to today, how many women or people have you enrolled in Medicaid?
So we think about it in the family level. And so we're working with about 27,000 families today.
That's incredible. Congratulations. All those people now have healthcare coverage.
So it's a lot of laundromats.
Yes. And what's the like typical person that you want to hire to your team to like actually go do the work of having those conversations and building the connections? Like what do you look for in terms of background?
It's pretty simple, but not easy. It's a little bit like that famous Supreme Court case of you know it when you see it. That was related to obscenity. But in this case, we hire at the laundromat. And so we not only have hired multiple people that we've directly helped who say, this is great, I'd like to be involved at Fabric. And we have the ability for people to work part-time on the weekends because laundromats are busiest on Saturdays and Sundays. And so that's great that you can do a shift on a Sunday afternoon when things are busiest. But it is really about the desire to help and that connection to mission. And because so many of the people we have hired on our outreach and our Fabric member support team are from the communities that we serve, there's that immediate resonance. And so we've hired a lot of people from the laundromat themselves who either are laundromat customers or folks that we've directly helped. And the interview is go talk to someone, right? Can you build a resonant relationship? And then we can train and the product can teach on top of that.
And why did you decide to make this a company that raised money from VCs and was for profit, given you have such a strong mission orientation to what you're doing?
So the reason that we are a for-profit company and we intentionally actually registered day one as a public benefit corporation is because our profitability is predicated on our impact. And so for me, the best way to build a really big, scalable, sustainable business is to marry those two things together. And so, yes, health insurers have an incredible incentive to get and keep people on health insurance. That's a business need. It also is a very human and health need. And so I feel really good about the fact that our profitability is predicated on our impact.
And how has that been in the experience you've had thus far with investors? You obviously have some good ones already on the cap table, but have you had VCs say, we don't invest in these sorts of businesses. Like maybe our fund mandate doesn't allow it, or we don't know how to do it. What's been some of the reactions so far? And then how have you responded to that?
Absolutely. This is maybe a little controversial, but I don't think you can convince an investor or anyone of something they don't fundamentally buy, right? Like if they believe the premise of Medicaid isn't a big business with 1 in 5 Americans on it, or that everything should be an app and only an app, like that is not someone we are going to win over, or quite frankly, is going to be a journey partner for us. 80 million people are on Medicaid, right? 12 million of those are Medicaid and Medicare. People don't have hesitance of investing in Medicare and some of these other things. And when almost half of US births are on Medicaid, like it is a massive market and opportunity. And I feel very comfortable with this of building a business in that space and want to work with the folks that quite frankly are excited about that and aren't going to be tourists who are looking for the next fad. That's not who we are. Our premise is that the work is incredibly difficult, but it's actually simple. If you understand the population, you build for and in partnership with the families that you're serving. And we want to do that with folks who see that and kind of cut through the noise.
Yeah, that's fair. I mean, makes sense. Like go with the sort of natural allies, even if it takes a little bit longer to find them. So what is your take now on just the market that you face in not just fundraising, but since you started the business, like everything's gotten kind of crazy. I don't know how else to say it, but like it seems like every day I read a negative headline about the Trump administration and Medicaid and plans to cut Medicaid. And we're operating at a time when there is less conviction in digital health outside of areas like revenue cycle management and AI. So what's your take on how to navigate all of that? And some of it's obviously out of your control as one person, but any thoughts on just for those listening, like how do you navigate just the policy headwinds meets kind of the market we're seeing today?
Yeah, absolutely. So I think a lot of it is noise. So there was a recent Politico headline that said from Trump saying, "Don't fuck with Medicaid." And I think like that is the unspoken part, right? Is like there can be this window dressing, there's this noise and other things, but again, 1 in 5 Americans is on Medicaid. And I think there are these stereotypes of, the welfare queen and like things that I think are incredibly damaging. But a lot of people, well, one, I think that is a totally unfair stereotype to begin with. But a lot of people who wear red MAGA hats are on Medicaid, but it might be called TennCare in Tennessee or something else. And I think the reality is if Medicaid was gone tomorrow, I think Fabric Health success would be the least of our problems because we would be in a recession, if not a depression, because every hospital, whether it's CHOP in Philadelphia or a rural hospital in Arkansas, is undergirded by Medicaid. And so I think there are a lot of things that are politically expedient to talk about right now. But not only would, we have an absolute maternal care desert in every corner of this country, but every nurse, every cafeteria worker would suddenly be out of work in every small town in America. And so I find it to be a lot of noise that certainly raises my blood pressure. But I think it's a lot of noise at the end of the day. And when you think about the policies that they're talking about right now and seem likely to come down the pipe, things like work requirements, I think.
Yeah, I wanted to ask you about that. What are your thoughts on that? Because that does seem to be moving forward.
Yep. So, I mean, personally, I think it's bad policy when 90% of Medicaid recipients are either working or would not be required to work and do those things. But at the same time, like we already built work requirements into the Fabric Fam platform because in the same way that you have to certify income every 6 months for SNAP annually or more frequently for Medicaid, there are all of these tripwires that are already built into being poor in this country. And so I was just in person with 50 execs from one of our plan partners. And when the question of work requirements came up as an RFP is coming out, and they said, "How are you thinking about work requirements?" And it was this fascinating conversation of like cartoon mouth open of how Fabric has already productized that and how we would think about it. And this is a big five insurer who said no one in our organization has a plan yet. And so we're here and we're ready and we're built for that. And we've learned all of these lessons by building products in the middle of the public health unwinding, where 25 million people lost Medicaid and 70% of them were for paperwork because it goes to the wrong address. It's confusing. It's multi-step, all of those things. And so I think the reality is it's a huge problem, but it's one that Fabric understands and is built for.
And how do you view things on a state by state level? Because you're not in every state right now. You've sort of picked and chosen your areas. I know you and I have talked quite a bit about New York, for instance, and I live in an area where I'm in Queens, so I could see the value of a Fabric. But we've talked about the complexities that you see in certain regions, both with languages as kind of one factor. I mean, Queens has 140 languages. But then I also have been reading this. Medicaid is very state by state, and there are some states that I am worried about more than others. So how do you think about the kind of state strategy as you roll out Fabric?
I think the benefit and the challenge is there are 56 different Medicaid entities, and you have to understand them. And healthcare is local. And in our earliest stages, we went from Philadelphia to Pittsburgh because while they share a state border, they couldn't be more different as communities, as healthcare, like local ecosystems, and all of those things. And so we have found that the Fabric model applies regardless of community. So there are definitely those realities of various state contexts, and I don't minimize that. But we actually are going to our next 2 states because the state secretaries of Health and Human Services, or the Medicaid directors, have asked for Fabric to be in those states. And so I think that's an incredible opportunity. I think the other thing is, one of the things I talk about a lot at Fabric is one of my short phrases that I stumbled on in trying to explain how Fabric's approach works is it's got to be muffins before mammograms. And I think fundamental to that is you have to build a relationship and you have to have trust, particularly when there's so many scams, when there's so many things that just don't work for working class families and are incredibly difficult, that when you build something that is resonant, both to the families who are on Medicaid, Medicare, Marketplace, et cetera, states see it. So we have had states from Wyoming to Alabama ask about Fabric. And so, of course, we are being thoughtful of where we are going next. But I think there's actually less of a chasm in the kind of real world and on the ground than it seems in the headlines.
Hey, everyone. We'll get right back to the conversation after a word from our sponsors. If you're the decision maker at your company, we have great news for you, for your HR department and for your employees. A new and future-forward way to do health benefits is here from Thatch. Not only do your employees get better health benefits with Thatch, but you save an average of $1,620 per employee per year. That's right, you can save over $1,600 per employee per year. Plus, Thatch reduces the time your HR department spends administering benefits. Businesses all over the country love Thatch's breakthrough approach. Rather than a wasteful one-size-fits-all plan, Thatch empowers your employees by letting them customize their own benefits plans. You save money and time while providing your employees with better health benefits, which works better for everyone. Book a demo with Thatch and we'll send you a $100 gift card. Visit thatch.ai/HR to book a demo for your gift card. That's thatch.ai/HR. So let's talk a little bit about Medicaid, because it seems to me that Medicaid is one of those areas right now. I mean, it's always been underserved. Nobody's wanted to invest in it because it's perceived as having lower reimbursement rates and being extremely complex, and so many reasons. And what's been interesting about kind of tracking your business is you have, I'm not going to share metrics, but you have real traction, you have revenue, and you've grown quickly, and you've got a lot of the kind of what a VC would want out of a company when I look at things like that. And yet you're in this very tough corner of the market. I'd love your both bull and maybe I'm going to push you on bear case of investing in Medicaid. Imagine you're the check writer. Give me a little flavor of both.
Yeah, well, I'll take the challenging one up front and we'll see how this goes. I think if you fundamentally believe everything should be technology, and that is the only way you do things, and that's the only way you see, you're looking for SaaS margins, and you're talking about the flywheel and the hockey stick. And it's like, if that is what healthcare is to you, and I think like there's a reason we talk to healthcare investors, then you shouldn't invest in fabric. But quite frankly, you shouldn't be in healthcare, because if you don't think anything in healthcare should touch a real human, that's what people want, right? Like that's, and going back to Medicaid is state run, like that is what states want, right? Like they want services that are culturally competent, that are actually helpful, that respond to what their residents want and need. And that's what they find moving the needle. And so I don't think fabric is the right investment for a lot of investors. I also think a lot of investors who want to be doing pure tech shouldn't be in healthcare. I think it's just a very different market, and we'll see how I use my words in some of the responses. But I think it's just, there is a human component to healthcare, right? Like anytime you get on the phone, the first thing anyone does is press 0, right? And that is to try to get to a human and to get an answer and that kind of resonance. I think on the why I'm still optimistic about Medicaid is, one, we were profitable before we raised $1 of venture capital. And if we can do that with the margin profile that best in class investors are looking for, like we have those proof points, right? And I think just the fundamentals of 1 in 5 Americans on Medicaid. I feel like investors are always asking on one of two questions of like, is this a really big business? And it's pretty hard to not touch 20% of the economy and build really big businesses. And does it scale? And we found in a short period of time across pretty radically different communities and neighborhoods in different states that it does.
And just taking a step out from the fabric POV, but where else do you see these big opportunities in Medicaid, given how much time you spend in the market? Like if you were sort of rooting around for other areas that you could see, like either businesses be started or maybe there are companies, but they just haven't gotten to scale yet, but you see huge potential. Anything you would call out?
Well, I think Medicaid at its core, and regardless of the policy context and what might come or not, is moms and kids, right? If I look at a state's pay for performance measures or their penalties, they are around a level of care for moms and kids. And so I am hopeful we're going to see more in pediatrics. And I'll give you an example of why that is. We know that well child visits are critically important for a multitude of reasons, right? Like not only kids being healthy and having the best start in life, but also because the dollars are really tied to those well child visits and those gaps. And somewhere like DC, there's actually a $40 penalty at a floor for every kid whose EPSDT measures aren't closed, and those pediatric well care measures. And I was in a Philadelphia laundromat with the Pennsylvania Secretary of Health and Human Services 2 months ago, and this mom I was talking to told me that she didn't need any help scheduling pediatric appointments. And it's like, that's so great. And then she told me that her daughter had already had her 6-month visit. But to her, she was done, right? Like 6 months was the pediatric spectrum for her. And she thought her daughter was done and taken care of. And so I hope we see a lot more in pediatrics, because it's incredibly important, not only in terms of the health impacts and for the communities that I deeply care about and Fabric serves, but also from a healthcare and economic standpoint. I think things that are happening or need to be happening in maternal health and in pediatrics are really, really exciting to me. And I'm crossing my fingers and toes that there's more there.
That makes a ton of sense. And I remember one of the first conversations you and I had was actually about obstetrics too, because you pointed out that so many of these women at the laundromat are pregnant, and some of them may not be getting the maternal health visits that they should be in order to stay safe. And we all know about just horrible rates of maternal mortality in this country that we don't see in other developed nations. And so that also seems like an opportunity. Have you had any kind of further thoughts or made progress in that area?
Yeah. So on maternal health specifically, we are partnering more and more with providers who have actually come to us, who are struggling to find these moms early in their pregnancy and get them into the continuum of care. I totally understand how these benefit designs and other things happen, But I'll give you an example of where this breaks down and where I think there's such an opportunity for innovation, because I think the work, again, is simple but not easy. And so there was a woman, Karina, who we serve, and she was struggling to get maternal health care. And we meet her in that mythical time of first trimester, right? Where every plan and provider is hoping to get her in the door. But we were able to find her an appointment, a provider accepting appointments 7 miles away. But she was reliant on public transportation, and the provider was not in an area that she could actually access via public transportation. But her plan had an agreement with their transportation provider to only serve a 5-mile radius from her home. So it's those kinds of things that I'm like, those are endlessly solvable problems, right? You have a mom that we built trust with, that we have built the capital and spent a little bit of trust to make this appointment and go to the doctor and everything, schedule the appointment, and then it breaks down. So it breaks down right in terms of the shortages and accessibility of care, but then it also breaks down on the transportation side. And like that is a benefit that Medicaid plans are paying for. And so I think there's an incredible opportunity in rerouting some of those systems.
And what did you end up doing in that case? Did you find a closer clinic, or did you find a way around the transportation problem?
Well, one of the benefits of working deeply with the plans and providers is things like this happen every day, but the health plan or the health provider doesn't know what actually happened, right? It's an invisible problem to them. And so we can call the health plan and say, this is what's happening, or we can call the provider and say, this is what's happening in that situation. As a partner plan member. And so you can call the plan and have a conversation around that, because that is something, as soon as you raise that problem, they understand and actually want to fix.
Yeah, absolutely. I mean, it's so for a plan, like that person foregoing that care. I mean, let's walk through it. Like if they don't get the appointments all the way through the pregnancy, and there are an increased rate of complications or something happens to the baby, we're talking about hundreds of thousands, if not millions of dollars. Whereas what you're saying is this transportation benefit, if we were able to extend it from 5 miles to 7, which is literally a 5-minute, 10-minute extension, costs almost nothing. It's the difference of paying a sort of standard rate for a pregnancy and postpartum experience versus millions of dollars.
Right. And I think I could call any health plan leader in this country and they would be like, please just put it on, like, I will book the Uber for her right now. Like, this is ridiculous. What are we having a conversation about? But I think healthcare has all of these trap doors. And we wonder why things aren't working. And it's like, well, trying to get the care and trying to do the thing that the system desperately wants you to do is incredibly difficult. And we make it really, really hard. And then we're like, why are patients non-compliant? I'm like, excuse me, like we have made it to be the seventh circle of hell to get out of here to actually get care.
Yeah, Courtney, I agree with you. It is just so endlessly maddening, and sometimes the devil is in the details, and it's very tiny, very subtle details that if you don't have an understanding of the human being, you'll miss it. And I'll give you one just very personal example that I think I've shared with you already, which is that I have an aunt who is what you would call a dual eligible. So she's both on Medicaid and Medicare and living in Missouri. And she had this crazy experience happen. So in addition to being a dual, she's also blind. She's completely blind. And she lives alone. And she was sent a physical paper letter in the mail from the government asking her to confirm that she was still blind in order to continue to receive her benefits. And of course, because it's not accessible, she does not fill out the paper form because she cannot see it, and then loses her benefits. And that's catastrophic for someone like my aunt. And the story that you just shared about kind of the transportation reminded me of this, because it is in the details. And I don't know how we can believe in healthcare that like the solution is just only tech. You have to know people and you have to know what's going on with them in their lives.
And I think piggybacking off that, which makes me think of two of the more subtle and infuriating examples I've seen recently, and it's all good intentions, but yes, it's like if you don't actually know the the users you're serving. I don't understand how you can build tech. Like, just, I don't understand how you can build tech. I don't understand how you can build operations. I don't understand how you can build a viable product divorced from the users you serve. And I think two of the things that I give two of our state partners credit for, because they did not realize that these were some things that they were causing. I won't put them on blast, but one of our states didn't realize that children were being auto assigned to different health plans. And so until we were meeting mom, who was uninsured, and we were trying to help keep her children insured and get them to pediatric care and all of those things, we realized she was navigating 4 different health plans. But those are the very kind of simple things that every health plan we talked to in that state, and the state was like, oh my goodness, that cannot be how things work here. Everyone has an incentive to actually fix that problem, but you would actually have to talk to and know the people you're serving to know that is a problem, much less fix it. Or another one is the caseworker offices in another state of ours, their phone number isn't coded and isn't registered with the telecom providers. So you lose SNAP, which also generally kicks off a Medicaid loss if you don't recertify your income every 6 months. But the call from your caseworker comes from a number that is coded on your cell phone as scam likely.
I can't handle it. It's so infuriating. It's like, it just blows my mind sometimes. And it's stories like this that, like, sometimes just make me reevaluate my politics without giving away what my politics are. Again, I feel like the driving force of this conversation, the underlying point that we just keep making again and again, is really that you need human beings in the mix, in the flow. Like, it's that human interaction that still matters. And yet we've gone absolutely gaga about agentic AI and replacing humans with AI. And to be fair, I do think that we should replace some aspects of things that people do with AI. Like, there are certain functions where it just makes no sense for a person to be doing it. But then how does an AI like draw out these kinds of details? And maybe I'm wrong, because you see sometimes that people use AI for therapy and find it very empathetic and whatnot. But like, I'm not there where I see this as kind of a better option than a really empathetic human being sitting there with you at the laundromat. So what do you think, Courtney? I think you and I might be aligned on this, but would love your observations on where you see it being useful and not useful.
Yeah, absolutely. So I think they're in the same kind of way of kids being assigned to the same plan, or parents being able to select the same plan and understanding what that is, or a phone number being coded. They're very, very important roles for technology. And we talk again about services enabled tech, and we have 837 days of learnings and insights that you can train an AI on, and that are incredibly important. But in this way of, it's got to be muffins before mammograms to us, it's like, how do you get the insights, right? Like, someone has to be training the AI. The robot does not know which way to turn, much less learn that empathy and that compassion, much less the insight that's the distillation of the problem. And so what we see is these incredibly sticky and efficient relationships that our team is building. And then, yes, we absolutely automate a lot of it. Like, there is a lot of eligibility, there are a lot of rules-based things, and that stuff should be automated. Like, part of the problem we have is so many of the county offices are these incredibly complex rules and scenarios expected to be in one person's head, right? And so we had this situation during the Medicaid recertification where everyone, for the first time in 3 years post-COVID, had to recertify for their Medicaid. And nationally, we did a pretty terrible job rolling that out. But the first thing we did was, we heard there was an app. We heard there were letters. We asked to see the letters. We downloaded the app. We saw that the first identifier you needed in one of the Medicaid recertification apps was what's called a CRI, or your case record ID. And then we asked everyone if anyone knew that number, and no one did. Like, the health plans didn't know it, the state didn't know it. And so I think there's a really important opportunity and role for very intelligent tech to be making life easier and more efficient. but you still have to build the trust and you still have to distill the problem to be able to make it efficient. And that's what we see all the time is once we get you into the Fabric Fam network, like you come back to us. You refer your sister to your point of therapy. There is a therapist in North Philadelphia who gets people on Fabric Fam every day. And she is just like, these are the people you need to talk to make sure that you're good. And I've never met this therapist. And so I think once you build trust, people will bring other people to you, but you have to do that work. Like if you're not willing to put in the legwork and introduce yourself and answer a difficult question from someone of who the hell are you and why do you want this information? The rest of it is lost.
Courtney, well before you started the business, I'm sure there was a moment for you that you learned how to do this kind of grassroots. I mean, what you're talking about is community organizing in a sense. And I associated it mostly with political campaigns. But did you have a moment in your life, maybe years before you started this business, where you realized that there was power in this? Or maybe you started doing it yourself? Would love to just know more about that.
Yeah, so my background is in education before healthcare and specifically in Medicaid. And I think I was looking for Medicaid. I didn't quite know it. And so there is no more humbling lesson than being in front of a room full of 30 high school seniors who tell you exactly what you need to know about how things should work. And I learned that lesson many, many times. But I think one of the first things is my students would change phone numbers frequently. And so Sade left her backpack in my office one day and I went to text her and her phone number was off. And so I posted on my Twitter page and I said, can someone get in touch with Sade and tell her I have her backpack? And I got a call 30 seconds later from her cousin's phone. And she was like, oh, that's where I left it. I'll be back in a minute, Bragg. And so I think there's a little bit of like how you build that relationship and how you get out and know people and what they need and what things look like. But the other was when I started in education and I taught in Southeast DC, about 90% of our kids would get HIV tested. And that is not a traditional role for education. But in a city like Washington, DC, where there are epidemic levels of HIV, we asked the most popular student to get tested first. And then everyone lined up behind Tyrell and got tested. And so I think those insights are hard earned and they're part of Fabric's DNA. But yeah, it really comes back to my students.
So, I mean, you've gone to some good schools. I believe you and I kind of bonded about you having gone to Dartmouth because my husband went there and it's like a whole thing.
Yeah, the Dartmouth community is die hard.
It's die hard. But you've got a background in some ways that I don't see very often in startup land. You've been involved you mentioned teaching. You've worked in kind of the nonprofit universe. You're not the most typical founder. When I tend to look at the resumes, I see a lot of Bain and Booz and Harvard Business School and just a very different path and corporate jobs on Wall Street. Do you have any thoughts on just like for people listening who maybe have more of a background that's akin to yours, where they've been in public health, they've been in education, they've been in social work, and believe that maybe there is something to build that's more scalable, and they want to start using tech, and they want to raise capital, and they want the things that you want. Like, what advice do you have for them?
Ooh, I mean, I think so. I started my career at the KIPP network of charter schools, and helping found a school is a humbling and incredibly gratifying experience. And KIPP talks a lot about grit. And so there's a lot of what I think are earned insights because I've done the work. And I didn't do the work because it was a path from A to B. Like when I went to business school, I didn't know what venture capital was. And I went to a dinner with a big Silicon Valley investor because it sounded interesting to me, but I didn't know what it was. And I realized just like what a different world I was in. And that was initially really intimidating to me, right? Like when I did my summer internship in the Bay Area, someone had told me, but like, you haven't had a real job yet. And I was like, excuse me, like I built a school. I've like integrated operations post merger in an international school system, but like I hadn't had that traditional experience. And I think what I learned is I've got something that I'm sorry, like all of those vest wearing bros don't have. And that's an actual insight. Like that is a drive to do something. And I think there's a lot of froth and there's a lot of noise in venture, but I think you've got to be obsessed with what you're building because you care deeply about it. And I don't think most people care deeply about what they're building. I think like they want to fail forward or they want to have a cover on some fancy publication or something else. But like, this is the work that I wake up to do every day, right? Like one of my old students is Fabric's photographer when we do events and stuff. Like it's who I am and it's what I care deeply about it. And so I don't think people should build just to build. But if you can't let an idea go or you see something broken, like run through a brick wall because things need to be fixed. And I think the real things that stand out are based on those really earned insights and the grit to make those things come true.
Yeah, and I love that you use the word grit because I've learned it the hard way through investments that I've made. And if you don't have grit, like it's just not going to happen. Especially in healthcare, it's hard. There are just so many times where it's just too easy to throw in the towel. And I agree with you about passion too. And I also think it's like, do you have something to prove to the world? And if you've been in education, if you've been in nonprofits, like I would bet that a lot of those people do have something to prove and that they've seen those things firsthand, the things that they want to change, and they've lived those experiences. So yeah, I totally buy it. So yeah, Courtney, thank you for coming on the podcast. This has been phenomenal. If anybody wants to find out more about what you're doing at Fabric, what's the best way to do that?
Fabrichealth.org, or you can shoot me an email at Courtney@fabrichealth.org.
What if I just sent out a tweet like, hey, Courtney, are you going to see it?
That would require, I mean, I believe when we met, you sent out a tweet and someone screenshotted it to me, and I didn't know who you really were, other than I thought you were smart and thoughtful and we were having a conversation. So that was the first time I had checked Twitter in a while. So we are on Twitter, but not wildly active. So you're probably better off emailing me or getting on LinkedIn.
I love it. Amazing. So yeah, thanks for joining us and keep us posted on all the work you're doing.
Thanks, Chrissy.
Thank you for tuning in to Second Opinion. If you got value out of this conversation, please share it with colleagues and Slack groups and friends navigating the industry. If you haven't already checked out the Second Opinion newsletter, you will get a link to subscribe in the episode description. Second Opinion is a part of Turpentine, the podcast network behind Econ 102 with Noah Smith, Turpentine VC, Complex Systems with Patrick McKenzie, and more shows for experts by experts in tech.